Hey, Dr. G here with naturalfoodsdiet.org. Today I'm going to go through the coffee enema procedure to show you exactly how you do it. All right, so why do we do coffee enemas? We do it for detox. It stimulates your liver, cleans out the toxins in your colon. So that's the reason we do it. Now, what kind of coffee do we use? You can use regular percolator coffee, or even better is to boil coffee. You boil it, you let it simmer for about 12 minutes. That's the best way to get all the antioxidants out of the coffee. The percolator coffee is not, the percolators don't go quite as hot, so they don't get quite as much of the good stuff out of the coffee bean. All right, I like to use an enema bucket. The reason for the bucket, it's easier to clean, it's non-toxic. You buy those enema bags, they're made of a plastic that who knows what kind of toxins might be in that plastic. We like to use a silicone tubing, and here's a medical grade silicone tubing. We need the tip that goes into the anus. This needs to be yay long, about 3-4 inches, and that's because it needs to go beyond the 2 anal sphincters. If you have a shorter one, or if you don't insert it all the way, then the coffee will spurt back out because the internal anal sphincter may be closed. All right, so today I'm going to demonstrate just how you assemble this. We take our enema bucket, we attach the tubing, which is usually pretty simple, although today, of course, it's not so simple. This is a new tubing, so I'm used to the tubing. Of course, it stretches with time and becomes easier. Now the next is the stopper, so this plugs the tubing. The best way to do this is to put the stopper in so that this click mechanism is pointing away from you. And then if you can imagine the enema being inserted, and we have this stopper on the tubing, it works better if it is pointing away from you. All right, so we insert this. Now the coffee enema, you want to have it about body temperature, the coffee. So of course, if you just roast some coffee and just put it straight into you, you'll get a surprise that's not very pleasant and burn your rectum. So we want to try to avoid burning your rectum. The other thing I'd recommend is if you have any kind of medical condition, especially any kind of medical condition concerning your anal area or rectum, be sure and get your doctor's okay before doing a coffee enema. All right, so we try to push this through. And it's a slow process until we can grab it, and then it is quicker. And we slide it down so that you can easily reach it. So we slide it down about 1 foot or 1.5 feet so you can easily reach it. Then we want to close it. Now this is really important before you put the coffee in here. If you don't close it, your coffee is going to pour right through. Now the next thing we're going to do is insert the tip onto the tubing. Very simple to do. So I have as a demonstration here. Now the markings inside the bucket, which I'm sure you can't see, but the first marking is 500 milliliters. That's the amount I use in the enema, and I work up to that slowly. Now I like to put in about 2/3 of that 500 milliliters of coffee, and then the last third of water. You want to use a clean water, either filtered water, purified water, distilled water, so that you don't enter toxins into your body directly through your colon. See, the colon bypasses some of our detoxification methods, such as our stomach acid. So we want to be careful about anything you put in the rectum. So we pour in the coffee. We have the clamp closed so it doesn't pour all the way through. And we fill it up to just about 2/3 to the 500 milliliters, and then take it up to the 500 milliliters with the water bottle And I would start off with maybe 1 tablespoon of coffee, about 1 cup. And then once you're an expert, I recommend going to 2 tablespoons and about 2 cups, 2 to 3 cups of coffee per enema. Now again, check with your doctor if you have any concerns about the caffeine in coffee or any concerns with your rectum or colon. Now, we want to elevate the coffee above our body because it's gravity that allows the coffee to run from the enema bucket into the body. So we elevate it, and this bucket here is a good elevation. So if my body were even with the table, this would be a good, and it would pour in rather quickly. All right, so we have the stopper off. So what I do is I put something underneath to tilt it like this so that I'm getting all the coffee out of the bucket and don't leave any in there. All right, so I put the enema tubing above the bucket, and that way it's not going to pour all the way through and get me all drenched in coffee. So what happens is you'll see coffee coming down into the tubing. And what you do is you lift it up till all the air is out, like so, and then bring it down and you see the air is gone. And what I'm able to do is slowly bring that down till it's up to the tip that we're going to insert. And once it reaches the tip, then I want to close the latch to shut off the tubing. And here we're ready to insert. Now we make sure the coffee's not hot. We want to lubricate it. You can use olive oil. Don't put too much. Don't slap a ton of oil on it, but a little bit of olive oil, a little bit of coconut oil, a little bit of petroleum jelly so that it will slide in easily. I usually also apply some coconut oil or olive oil to the anal area, and that way when you flush the coffee out of your system, it's easier to wipe because you've had this lubrication. It protects you from chafing around the rectal area with repeated coffee enemas. I recommend doing the coffee enema daily. This is a daily detoxification ritual. I've had many patients get many benefits from this. So we insert it. Once this is in the rectum, we release it, and it varies how much time it takes to come out. Usually it's fairly rapid. Sometimes you'll feel a cramp. Now, women, you know what I'm talking about. Women out there that have had babies, when you get a contraction and they tell you not to push, well, that's what you do when you get that urge, that cramp to defecate. You breathe through it and you relax. And this is good for you to learn to control your body and to relax. So we control our body, relax. We try to get all the coffee in. Once you see air here, that means the coffee's in. The air is not going to come all the way down to your body level. It will stop about a foot above. So when it's a foot above, it's not all going to run in. There's not enough pressure from this amount of coffee. So once it's down to here, we would clamp the hose with our gizmo here. We clamp it closed. And be sure and do that before you pull it out, because I've made the mistake where I pull it out without clamping the hose, and then this last bit of coffee is going to run all over your bathroom floor or all over your body. You take it out with the clamp closed. You gently set it down on a towel that you have nearby to catch accidents. And then you want to try to retain the coffee. I recommend retaining the coffee for 20 minutes. So we sit there, we meditate, read a book, listen to some quiet music for 20 minutes. It's very relaxing. And then after 20 minutes, you get up and you expel the coffee and usually your bowel contents into the toilet. I'd recommend sitting on the toilet for about 3 to 5 minutes to be sure everything's out. Usually if you wait that long, everything will be out and you go on about your day, and that's it. There's no more coffee comes out. So again, this is the procedure for the daily detoxification that we recommend, and that's the coffee enema. It's used to treat cancer. It stimulates the liver to more powerfully detoxify all those toxic chemicals in your body. And it cleans out your colon of all that junk that our body's trying to expel, and so that it's not retained. This is Dr. G. Thanks so much for watching.